He is outside this morning with Dr. Jill trying to find out the best way to determine whether or not your pet is in pain. Hi, Paul.
Yeah, speaking of doctors, and actually, you know who's misbehaving? Diva down here, who knows that there's treats on the table. I've never seen her so rambunctious.
Yeah, she loves these treats.
Troublemaker.
Yep.
We're talking again about how to know when our pets are ill. And I mean, there are times when it's obvious. My dog's got a limp, it whimpers, but it's not always obvious.
No, you know, a lot of people don't realize their pet's in pain. For example, kitty cats. If you see them hesitate.
Look at that. Look down here. You see this?
Oh, yeah. So these are pain treats.
Troublemaker.
You can clearly see that they're not bad tasting. She likes them.
Is that actually, would you call that a med? What's going on there?
Yeah, this is a med. It's called Synovi G4. They actually have boswellia and turmeric in them. They're natural, but they're fantastic for pets' pain.
All right, so and they clearly like them. Okay, back to again identifying a pet when they're not well, when it's not obvious.
Right. You know, a lot of people don't realize, for example, when your animal or your cat, especially when they try to stoop down and jump up onto a counter and they hesitate, that can be a painful episode for them to get back up onto a counter, jump back down. People don't realize cats have a lot of pain issues. They also make a gel for cats now because cats aren't easy to medicate.
I rub that in right through the fur?
No, well, no, that's this product.
Oh,
this one you rub right in. This one is oral. So, you know, looking at their face, are their eyes bright? Are they anticipating their next move or trying to get down the stairs? Touching them on their back, for example, a lot of times when you look at their back, is it arched? Or if you see them at the park, are they really limping or are they bunny hopping?
Okay. Yeah, and it just seems to me, besides the obvious, any change in this dog once more, any change in behavior is something to make you stop and pause, right?
Yes, you bet. You know, lack of wanting to eat, obviously, or sleeping a lot, restless nights, not trying to get comfortable. A lot of times dogs will circle and circle and circle to get comfortable before they finally go to sleep.
Well, let's talk about some remedies then. You mentioned these snacks, which do we have to limit how many of those the doggy has?
You do, actually, yes. There are pre-medicated snacks.
Okay.
There's also fish oil. I want to make sure people understand coconut oil and fish oils are very helpful for inflammation.
Okay. Can I give fish oil to the fish, or is that wrong?
No, that one's wrong.
Okay, all right. And then, so body sore biscuits, again, there's a number of different choices, apparently, that, you know, they can just take and they think they're having a snack.
Right. These are actually Chinese herbs. There's a whole host of different ways to do this naturally.
And speaking of natural and Chinese, take a look. I know you're an acupuncture fan.
Yep.
We have some acupuncture needles there.
Chiropractic adjustments, all kinds of things, laser therapy. Check with your veterinarian. There are new boarded veterinarians out there for pain management.
Okay, great. Well, and I've seen you do chiropractic adjustments on a fish. I know you're willing to do that, so you almost anything. Jill, it is great to have you here as always. Diva, you were a bad girl this week, but it's always nice to have your doggy here too. There she is down there, now waiting for her next snack. Bethany Crouch, she's poised and waiting.
She is poised and ready. All right, thanks, you guys. To schedule an appointment with Dr. Jill, and of course, if you go on out and visit her, you'll also get to meet Diva the Boxer, who's just so excellent. You can visit her website, drjyl.com, or call her up. The number is there on your screen, 916-989-0738.